4 TDs, Deputies Paul Murphy, Marc, Cathasaigh, Darren, Oireachtas and Gino to discuss the supports needed for those suffering with long COVID. So no the one. Everybody has a minute.
I think Gino's not here, so if we get...
Well, then you'll have a little extra.
Okay.
Yeah.
Thanks, Ms. Corla. I think in future we will look back at this moment and how the world's governments are treating COVID, and we'll say it's a social crime, a decision to allow COVID to basically let rip, condemning millions of people to death, but also tens of millions of people, condemning them to a marginalised existence because of long COVID and how states are treating long COVID. Hundreds of thousands of people in this country are affected by long COVID. This is an ongoing mass disabling event. And we're not just talking about people being a little bit fatigued. You're talking about children who are not able to go to school. You're talking about adults who are no longer able to work. You're talking about people who aren't able to breathe properly. This is a very, very serious issue. And the problem is the state here has good words. We passed a very good resolution unanimously in the Dáil almost a year ago, but that hasn't been acted on. The long COVID clinics are not functioning properly. They're barely open a day a week, half a day a week in some cases. The government has no approach in terms of stopping the continuous spread of COVID, hasn't brought back in masking in healthcare settings. You've no awareness campaign for people. The government is not taking it seriously, and they need to.
1 minute, 20 seconds.
And I want to thank Deputy Murphy for coordinating an AV room event and for also the submission of this topical issue. And I think it is very important and timely. Points have been made already. When I speak to constituents who are living with long COVID and importantly their families, neighbours and friends, the issue of the lack of public awareness, the totally insufficient HSE services, clinical pathways, services and supports for children, a coordinated vaccination strategy that recognises long COVID and the need for continued support. You really hear from people the lack of recognition, the lack of voice and support, and particularly in terms of clinical pathways and those supports, both in clinical terms but also in financial terms.
Likewise, I want to thank Deputy Murphy for his work in this area, for coordinating that briefing in the AV room and for the coordination around today's topical issue as well. People living with long COVID don't feel heard, they don't feel supported and they don't feel believed, Minister. If you meet a person with long COVID, and I've been open about this, I meet a person with long COVID every day, I live with one, and they look fine, they look healthy. When they report to their GP, there's no test that they can take for long COVID. And so everything else is ruled out, or people talk about maybe you're a little bit down on yourself, or could it be this, or could it be that. The provision of services is inadequate, the provision of awareness, not just in the general population, but within our GP cohort. In the area in the region that we represent, Minister, there are no long COVID clinics available. Waterford City, which provides health services for 600,000 people in the wider region, has no long COVID clinic available. If you're struggling with your energy, the idea of travelling to either Dublin, Cork, Limerick or Galway to access services is untenable. And we don't have a clear picture of what this issue actually looks like. Minister Butler, when replying to a question to me, talked about follow-up after disease acquisition survey to be completed Q4 of this year. But there isn't a correlation between acute COVID and long COVID. So how we're going to access these people, how we're going to find out how many people in the general population are affected by this disease, I'm not seeing the approach at a government level.
We don't have a reply to this topic yet.
If it's okay, I can pass it on to the deputies once I'm finished reading it, if that's okay. I do apologise. I thought they had been supplied. And again, just to thank the 3 deputies for bringing up this really important issue. And I'm hearing loud and clear what the deputies are saying, people not feeling supported. It is very concerning, I have to say, and just again to reflect that. And just advise the deputies that the HSE has developed an interim model of care for long COVID, which aims to build on existing service provision in addition to establishing new services across GP, community and acute hospital settings. The HSE identified early in the pandemic the need for this service and set up a multi-speciality, multidisciplinary team to develop the interim model of care under the auspice of the Chief Clinical Officer. The priority is to ensure that there are long COVID and post-acute COVID clinics operating within each hospital group, and noting the point made by Deputy Cathasaigh, to ensure a national service to close to home as possible for those suffering from long COVID. To ensure that this national service can be put in place, the Minister allocated funding which facilitated an overall investment of €6.6 million for long COVID service development in 2023, a trebling of the allocation for 2022. At present, there are 6 long COVID clinics and 7 post-acute COVID clinics operating nationally. The long COVID clinics currently operationally under the model of care include St Vincent's University Hospital, Beaumont Hospital. The post-acute COVID clinics are operational under the new model of care, including Mater University Hospital and Connolly Hospital in Blanchardstown. In addition, Tallaght University Hospital, St James's Hospital, Cork University Hospital, University Hospital Galway and Limerick University are operating combined post-acute and long COVID clinics. The HSE has also advised that there is a tertiary neurocognitive clinic in St James's Hospital led by a consultant neurologist with a background in neurocognitive disorders. This clinic is accepting referrals from long COVID post-acute clinics around the country. Recruitment, which includes consultants across a number of disciplines and administration, is underway. To date, 65.9 whole-time equivalent posts have been sanctioned across all of the post-acute and long COVID clinics. As of the 8th of September 2023, 46.1 of these posts have been recruited. The HSE has also commissioned a HIQA review of international evidence to further inform the development of the service, which results of which were published in December 2022. The review looked at 24 guidelines and 2 models of care and found that approaches and recommendations in the interim model of care are broadly consistent with those identified in this international literature review. An outline of epidemiological survey is currently underway at the FADA, which will prove insight into the prevalence of long COVID in the Irish population and risk factors in developing long COVID. The FADA study will determine the prevalence of long COVID for individuals diagnosed with COVID-19 between March 2020 and the 31st of January 2022 by PCR testing. The results of this survey are due later this year. Most children with COVID-19 infection have asymptomatic or mild disease. Fortunately, the incidence of severe disease and hospitalisation of children with COVID-19 is low. At present, for children and young people suspected of having long COVID, the diagnosis and care is provided by GPs and existing referral pathways within paediatric services. The evolving evidence regarding the impact of long COVID in children is being monitored by the HSE to ensure service delivery is adapted as needed. And again, thanks to deputies again for raising this issue. I will bring back the responses of deputies to Minister Donnelly, but again, noting the very serious concerns that they have raised. And I'll pass on the script to deputies as well.
My apologies. I should have called in the order Deputy Murphy, Deputy O'Cahasey and Deputy O'Rourke. My apologies. And it's 40 seconds each. Deputy Murphy.
Thanks, and thanks, Minister. I mean, what the people who are suffering from long COVID are saying is that the current model of care is simply not working and that there needs to be action, there needs to be change. The first thing is to try and stop more people having long COVID by stopping people getting COVID infections or reducing the number. Need to have education campaigns, need to have an emphasis on ventilation and clean air, as well as vaccination, need to have masking in healthcare settings. Secondly, they're calling for an awareness campaign to let people know that this is a danger of getting COVID. Thirdly, there needs to be a proper review of the long COVID clinics. These are not working. There's not enough of them and they're not operating enough, and there isn't enough referrals happening from the GPs. And finally, there needs to be financial support for people affected with long COVID.
Deputy O'Connell.
And to pick up where Deputy Murphy left off, if our health provision in terms of long COVID is hit and miss, well, it's substantially more miss than hit. I mean, the actual services provided in the long COVID clinics that exist are uneven at best. There absolutely needs to be an underpinning in terms of social protection for those people who are suffering in the long term, and a reliance on diagnoses is going to miss those huge number of people who diagnosed from that red line on the COVID test, on the PCR. There is no register, there's no record of these, and yet these people are suffering with long COVID in the longer term.
Margaret, the points have been made, Minister, and thanks for your reply. I'll start by making the point of there was a singular focus in terms of the clinical and refer back to Minister Donnelly. I think Minister Humphreys absolutely needs to be across this and involved in this as well. In terms of the clinical aspect, I think, you know, the capacity of services, the clinical awareness within those services, a point that has been made to me, and I know you did pick up on it, was, you know, the focus on pulmonary and cardiac and less so on neurology. I think that's something that needs to be addressed as well, Minister, but this is going to be an ongoing issue. It does need to be a priority focus. Margaret.
Thank the Deputies. I think those points made around public awareness and ventilation, clean air. There is a winter vaccination programme. I would encourage people to avail of the vaccine over the course of the next number of weeks and months. But the government is continuing to support the rollout of National Service for Long COVID, with 2.2 million in funding for implementation of the model of care approved for 2022, which trebled to 6.6 for 23. And is the interim care model that was developed by the group of clinicians across a range of specialities and disciplines, including leadership and representation from primary care, older persons, respiratory medicine, chronic disease, infectious disease, mental health and urology. A number of long COVID and post-acute COVID clinics are operational and seeing patients. But if there are challenges, I think it is important to tweak and you know, respond to the needs of people. Estimates of the proportion of people who are going on to experience long COVID type symptoms vary considerably in the international literature. As this is a relatively new condition, there are still considerable unknowns relating to the prevalence and duration of symptoms and the impacts of factors such as virus variant type, vaccination status and interplay of underlying medical and social conditions with post-COVID reported symptoms. The development of effective therapeutic options for patients suffering from long COVID poses significant challenges. Many of the proposed interventions for people with long COVID symptoms do not yet have sufficient evidence to support them overall, and effective strategies that address the multifaceted nature of long COVID remain elusive. Further future research investigation into the effectiveness and safety of interventions is required, and a large number of trials are currently ongoing. A recent HICWA report advised that in the absence of strong evidence to support the effectiveness of interventions for long COVID, a holistic symptom management approach should be used to support those living with COVID, including medical assessment and referral to an appropriate specialist. And again, in the few seconds I have remaining, I would encourage people to avail of the COVID vaccine. I'll pass on the response to Deputies, and again just noting the considerable concerns that they brought to us here today.